ಹಾಯ್ ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನೀತು ಮಾತನಾಡ್ತಾ ಇರೋದು. ಸೊ ಇವತ್ತು ನಾನು ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬಂದಿದ್ದೀನಿ. ಯಾವ ಯೂನಿಟ್ ಅಂತ ಕೇಳಿದ್ರೆ ಮಿಲ್ಲರ್ಸ್ ರೋಡಲ್ಲಿರುವಂತಹ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬಂದಿದ್ದೀನಿ. ಸೊ ಇಂಡಿಯಾಸ್ ಒನ್ ಆಫ್ ದ ಬೆಸ್ಟ್ ಲೀಡಿಂಗ್ ರಿನೌಂಡ್ ಬೇರಿಯಾಟ್ರಿಕ್ ಹಾಗೂ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜನ್ ಆಗಿರುವಂತಹ ಡಾಕ್ಟರ್ ಮೊಯ್ನುದ್ದೀನ್ ಅವ್ರನ್ನ ಮಾತಾಡ್ಸೋಣ. ಕೆಲವು ಕ್ವೆಶನ್ಸ್ ತುಂಬ ಜನರಿಗೆ ಇರುತ್ತಲ್ವಾ, ಆ್ಯಕ್ಚುಲಿ ಬೇರಿಯಾಟ್ರಿಕ್ ಸರ್ಜರಿ ಅಂದರೆ ಏನು, ಅದ್ರ ಬಗ್ಗೆ ಏನು ಭಯ ಇದೆ, ಅವರಿಗೆ ಮಿತ್ ಏನಿದೆ, ಸತ್ಯ ಏನಿದೆ, ರಿಯಾಲಿಟಿ ಏನಿದೆ. ಸೊ ಇದನ್ನೆಲ್ಲ ಸಪ್ರೇಟ್ ಮಾಡಿ ನಾವು ಡೈರೆಕ್ಟ್ ಆಗಿ ಡಾಕ್ಟರ್ ಸರ್ಜನ್ ಇಂದಾನೆ ಕೇಳೋಣ ಅಂತ ಅವ್ರನ್ನ ಮಾತಾಡ್ಸಕ್ಕೆ ಅಂತ ಬಂದಿದ್ದೀನಿ. ಸೊ ವೆಲ್ಕಮ್ ಆ್ಯಂಡ್ ಜಾಯ್ನ್ ಅಸ್ ಇನ್ ದಿಸ್ ಕಾನ್ವರ್ಸೇಷನ್. ನನ್ನ ಜೊತೆ ಇದ್ದಾರೆ ಡಾಕ್ಟರ್ ಮೊಯ್ನುದ್ದೀನ್ ಸರ್. ಡಾಕ್ಟರ್
Hi Neethu. Hi Manipal Hospital.
Thank you doctor. Thank you for having me first of all here because I have so many questions to ask and parvagilla ಎಷ್ಟು questions ಆದರೂ ಕೇಳಿ ಅಂತ ಹೇಳಿದ್ದೀರಾ. That's really nice of you. I think audience parvagi I want to ask you a few questions but so ನಿಮ್ಮ introduction is all everybody knows. ನಿಮ್ಮ Google ಮಾಡಿದ ತಕ್ಷಣ ಡಾಕ್ಟರ್ ಮೊಯ್ನುದ್ದೀನ್ India's best ಅಂತ, one of India's best ಅಂತ ಬಂದೇ ಬರುತ್ತೆ.
Thank you.
So doctor, shall I directly bombard you with the questions?
Yeah, please. Please carry on.
Okay, so see, being from the film industry, ನಮ್ಮ ಆ್ಯಕ್ಟರ್ಸ್ ಆಗಲಿ ಆ್ಯಕ್ಟ್ರೆಸಸ್ ಆಗಲಿ ಎಲ್ಲರಿಗೂ ಒಂದು ಥಿನ್ ಆಗಿರಬೇಕು ಅನ್ನೋ ಒಂದು ಮೊದಲು ತುಂಬ ಪ್ರೆಷರ್ ಇರ್ತಾ ಇತ್ತು. ಸೊ ಐ ಮೈಸೆಲ್ಫ್ ಹೆಡ್ ಗಾಟನ್ ಅ ಲೈಪೋಸಕ್ಷನ್ ಸರ್ಜರಿ, ಡನ್ ಕಾಸ್ಮೆಟಿಕ್ ಸರ್ಜರಿ. ಬಟ್ ಅಫ್ಕೋರ್ಸ್ ಟುಡೇ ವಿ ಆರ್ ಸ್ಪೀಕಿಂಗ್ ಅಬೌಟ್ ಬೇರಿಯಾಟ್ರಿಕ್. ಸೊ ತುಂಬ ಡೀಪಾಗಿ ಹೋಗೋದಕ್ಕೂ ಮುಂಚೆ ಫಸ್ಟ್ ಐ ವಾಂಟ್ ಟು ಆಸ್ಕ್ ಫ್ರಮ್ ಯು, what exactly is bariatric surgery and who are the type of clients who actually the patients who come to you?
Yes. Actually, people should understand the bariatric word is derived from the word called baros. Baros means overweight.
Oh.
The surgery done to treat overweight is called bariatric surgery. It's very clear.
Right.
So because as you mentioned, liposuction, right? Lipo is removal of fat from the specific areas of the body. It's a cosmetic procedure.
Cosmetic, yes.
It doesn't result in much weight loss. Bariatric surgery is a weight loss surgery.
Yes, true.
So bariatric surgery is a weight loss surgery. Liposuction is a cosmetic surgery.
Right.
Two completely different
absolutely,
things.
Absolutely.
So with bariatric surgery, what happens? People lose whatever the excess weight they have.
Correct.
For example, someone is 40 kgs overweight. They lose that 40 kgs. It doesn't happen with liposuction. Liposuction, maybe 3 or 4 kgs, that subcutaneous fat goes up and it's a cosmetic thing.
Yes.
It is more of a cosmetic than a contouring kind of thing.
Yes.
Shaping surgery. But bariatric surgery is a weight loss surgery.
So who are the kind of patients who actually visit you? Because from what I learned about you is that that not just India but people from worldwide visit over here. And I know that there have been more than 500 surgeries in this center, which is known as the Center of Excellence here. So if there are more than 500 people visiting here with this treasure of experience, who are the kind of people who actually come to visit you and who should visit you is what you would like to say about that?
Usually what happens is there is it is divided in the criteria of BMI, body mass index.
Right.
If you calculate weight in kgs by height in meters square, we get a value. That is called BMI. For example, you are 120 kgs. 120 by, if you are 172 centimeters, 1.72 to 1.70. We calculate a value that is called BMI. BMI should be less than 25 for a normal human being.
Right.
Okay. Because the height, the weight varies depends on height.
Right.
So it is different. So what happens is the BMI is more than 32.5. With any health issues like diabetes, blood pressure, cholesterol, qualifies for the surgery. Roughly using 32.5 is the mark where we decide.
Right.
And actually in our OPD, two type of crowds comes to us. One is young crowd, young girls with PCOD, hypothyroidism, and some people who are married with infertility. Those kind of crowds come to us. The other kind of crowd comes to us as elder people, 50 plus, which has severe knee pain, uncontrolled diabetes, uncontrolled blood pressure, cholesterols, snoring in the night, knee pain, breathing difficulty on walking.
Oh, okay.
Those kind of crowd will come.
Okay. But I want to know, what is it that drives you? Like, what is your passion? What keeps you in that passion that I must serve? Like, what is it?
See, I have seen many surgeries. For example, if you do a surgery for the kidney, it treats only kidney issues. If you do a surgery for the gallbladder, it treats only gallbladder.
Correct.
But this is the only surgery which treats many diseases. That drives me. I have to do a surgery which will treat many issues. I do a surgery, patients not only lose weight, they stop the medicine for diabetes, they stop the medicine for blood pressure, they stop the medicine for cholesterol,
overall
PCOS, thyroid, so many health issues they stop.
Right.
So that's the thing which makes us passionate about it. People come with so many health issues with a big list of medication, 15 tablets they take, 10 tablets they take. Once I do surgery within 6 months or 8 months, I can't say completely, but at least 8 out of 10, I stop the medicines for them.
Wow. So it's basically also overall health. Something that is never highlighted because always it's only about weight loss.
See, what I feel is obese patients, what happens? The organs are under stress. Definitely wear and tear will happen.
Yes.
So what happens once we do the surgery, the organs will have relaxation for them. They need not work that much to pump the blood. Understand,
So
right?
it's more.
So it is like not only these things, health issues, the longevity of the life will increase. People may look healthy, they may look charming, they may look healthy, but what happens once they lose weight, definitely the metabolism will improve.
Right.
The longevity, the life will increase. That's what I feel. People who we operate, they live 10 years, 15 years longer than what they have to live.
Yes, that's amazing, doctor. So doctor, I have just a very common question, So ತುಂಬಾ ಜನ ಇವಾಗ ಪೇಷಂಟ್ಸ್ ಬಂದಾಗ ಎಲ್ಲರಿಗೂ ಒಂದು ಗೋಲ್ ಅಂತ ಇರುತ್ತೆ. So do they pressurize you that ನಮ್ ಗೋಲ್ ಈ ತರ ಇದೆ, ರೀಚ್ ಆಗಬೇಕು ಅಂತ? What is a common goal that you've heard?
See, many of the times who comes to us with 100 kgs, 120 kgs, they come and they show some actress photo and they say, we should look like this. We may not make them exactly like that, but at least in and around that place. For example, if a person is 100 kgs, they come to us. According to their weight, they should be 60. Out of 40, they may lose 35, 36 kgs.
Oh, that's a big number.
Good number. That's 90% of excess weight loss.
Yes.
So that's what happens. That's what I'm saying. May not be exactly that, 5 kgs plus or minus. We do the surgery, but what happens? They have to make their workouts a little bit. If they make their workouts, they can minimize the loose skin.
Right.
Many people think that when you lose weight, they have loose skin. No. We have it.
That's a myth, right?
That's what I'm saying. Once we do a surgery, while losing, they should do the exercises.
Right.
Not after losing. Many people do. When you do the surgery, they will not be visible for us for 8 months or something. They disappear. They come back, we have loose. No, nothing like that. If you work out during the weight loss process, and if you are in touch with us, if you are in touch with dietitian, if you are in touch with our trainer, we have personal training for it.
Oh wow, okay.
So if you do that, definitely the loose skin will be minimized. Some may not have at all, but some have little loose skin. But they can minimize it. That's what I can say.
Okay, doctor. When patients are considering the Miller's Road, you said it is also the center of excellence here.
Correct.
So, what should the patients actually keep in mind when they are coming to meet you, or what is it that they can look out for here?
Yeah. See, what happens is many of the centers, what happens, they may be doing different surgeries. The problem with India is a surgeon is called general surgeon. Means they do general surgery, they do top surgery, they do bottom surgery, they do abdomen surgery. No, we are not like that in our hospital. We are very, very specific. We do this surgery day and out. So what happens is the results are very good because we do it with a passion.
Right.
And weight loss is our passion. So not only the surgery, post-surgery care, that's we are very good at it. For example, we have WhatsApp groups where we add a lot of patients. Each group has around 300, 400 patients in each group.
Oh.
WhatsApp group.
Okay.
In that group, I am there, my trainer is there, my dietitians are there, my whole team is there, coordination team is there.
Okay.
So post-surgery also, if any doubt is there in at home, for example, I can eat this, I can't eat this, what I should do, what workouts I should do, everything will be guided in the WhatsApp.
Okay.
So you need not come for a small things here.
Right.
So in this way, I'll be in touch with the patients even after years after surgery, 5 years, 6 years, 7 years.
So you're literally hand-holding the patients throughout.
Yeah, we don't charge for that post-op.
Okay, that's important to know. So, doctor, you were just telling that, ಇವಾಗ ಒಂದು ವಾಟ್ಸ್ಆ್ಯಪ್ ಗ್ರೂಪ್ ಥರ ಇದೆ and ನೀವು ಇದ್ದೀರಾ ಅದರಲ್ಲಿ ಅಂತ. So, of course, ನಾವು ಯಾರು ಇಲ್ಲ ಆ ಗ್ರೂಪಲ್ಲಿ. So, in case you have to tell the audience and the patients who are looking at this, could you just walk us through what it looks like in the life of a person who wants to get the bariatric surgery done, like before and what is expected after?
Correct. So what happens when the patient comes to us, we will first take his body mass analysis,
Right.
BMI.
Right.
That is called body mass. I'll show in the later my OPD.
Right.
What happens is we calculate the body mass index in a machine. So we will get to know how much exactly fat percentage is, how much excess weight you are, how much muscle weight you have, how much water weight you have, how much mineral weight you have,
Okay.
and where and all the fat is distributed. how much you need to lose, how much inside fat, that is called visceral fat. People will be thinking this is fat outside, below skin. No,
Yes.
there is something called inside fat, which is attached to the intestine.
So we all have Google knowledge, so that's why we're asking you.
Yeah, that is inside fat
Right.
is the danger fat.
Right,
The fat attached to the intestines inside the abdomen.
right.
That's what reduces post-bariatric surgery. That's how you get to lose
So mostly on the
inside the abdomen fat. That is the disease. There's a fat which is responsible for diseases.
Okay.
That will go down. Once it goes down, the diabetes, blood pressure, everything will get under control.
Okay, so I also want to ask you, doctor. So, ಈಗ ನೀವೇನೇ ನೀವು ಹೆಲ್ತ್ ಬಗ್ಗೆ ಹೇಳಿದ್ರು ಅಲ್ಟಿಮೇಟ್ಲಿ ಪೀಪಲ್ ವಾಂಟ್ ಟು ಬಿಕಮ್ ಥಿನ್ ಸೊ ವಾಟ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಇಸ್ thin body for you? Like, what do you think that is? And are all thin people healthy according to you?
No, not all healthy people are thin.
Right.
The thing is, in Indians, Americans, you see these two scenarios. Indians are thin fat people, we call it as. What is thin means? The hands and legs are thin. We have a central pot belly. That is the Indian
a cultural
scenario.
thing.
Cultural thing.
Yes.
This is not healthy.
Okay.
People think it's healthy because our hands and legs are. No, you have a lot of fat inside the abdomen, which is causing the diseases,
Okay.
which is deranging your metabolism. That is slowing down your metabolism. That is called basal metabolic rate.
Right.
Why some people are fat and some people are thin? Because, for example, my metabolism may be good. That's the reason I'm thin. Somebody's metabolism has gone down. That's the reason. Whatever you eat, you may not eat also gain weight.
Right.
That is because of low metabolic.
Doctor, I'm interested to know, like, safety is really a big concern.
Correct.
Ivaga, when we come, there are many people who come in a very naive mindset. Some people who don't know how to take care of themselves, may not have family with them.
Correct.
So if it is about safety, one that you provide, but overall, what do you wish to tell the patients about this?
See, there are a lot of myths around the safety of this procedure.
Right.
But to be very frank, for example, I can say our cameraman Kiran is. So he's doing the same work every day.
Correct.
He does this good job.
Yes.
If I come and do that, I may not be good at it.
Right. Right.
That's the reason I am also trained in so many countries for it.
Right.
That's the reason we can produce our results good. Understand? So I do the same procedure every day. So I may be good in it.
Correct.
So that is the reason the results will become better if you get that surgery in a center where they are doing more surgeries. So we have a separate camera for it, we have a separate OT for it, we have a separate team for it, we have separate dietitians for it, we have separate trainers for it. Everything is separate.
Okay.
So in this way, the results are good.
Okay.
We don't see much complications here
Right.
because we do it every day.
Correct. That's true, doctor. So, but what are the risk factors involved, if there are any? You know, like if somebody wants it for their health purpose, but they are not reaching out because they are worried about the risk factor, what would you say is a risk?
I feel being obese is more riskier than doing a surgery.
Okay.
Because the reason is, when you're obese, your organs are getting damaged, your liver is getting affected, your kidney is getting affected, your nervous system is getting affected, your mental health is getting affected, you are getting depressed. So many things are happening being obese. Okay, now if I do a surgery, for example, within a week the patient loses 6 kgs. They started walking, the breathing difficulty comes down. While claiming stairs they have breathing difficulty, that comes down. Within a month, we stop the medicine for diabetes. Within 1 week or 10 days, the patient starts walking normally.
Right.
Within 2 months or 3 months, the patient starts running.
Okay.
So definitely, it gets better with the surgery. And the complication, what people say is, the complication rate is 0.5 to 1%. For example, we are all sitting here. What's the guarantee that we may cross road safely? There's no guarantee.
True. I agree.
So here, why we are saying Manipal Miller Road is our complication rates are far less.
Lesser. Okay.
Very safely we are doing.
So they can actually come to you with that confidence. They just have to surrender. Like just be free.
You said worldwide people come.
Yes.
See, nowadays what happens, money is not an issue. On those times, money was an issue. Now,
True.
4-5 lakhs is not a big issue.
Correct.
So now, people will go to the place where it is done safely.
Absolutely.
Even you have to travel 7 oceans, they go and travel.
Yes.
So that's the reason we do it safely. That's a word of mouth which spreads everywhere. That's the reason people come from across the globe. Because people want to see how safely, who can do this safely. So that's the reason people prefer this.
How many days are they expected to stay here, doctor? Like when they get
Say
the
roughly
surgery
2 nights.
done? 2 nights, okay.
1 day prior admission, 1 day later discharge.
Discharge.
But surgery takes only 1 hour. Within 2 hours, I'll make them walk. There is no bed rest at all.
Oh.
There is no bed rest at all. At least in cesarean, you have to be bed rest. No, here there is no bed rest at all.
Okay.
Within 2 hours, I'll make them walk. Every 1 hour, they'll be walking. Next day, I discharge them.
Right. Okay.
So quick it is.
So that is about getting discharged from here. But then overall, how much time does it take for a person's body to adjust to the new person that
See,
he
what
or
happens?
she has become?
Only side effect which I feel about this surgery is you eat less. It's not like they can't eat.
Okay.
We do bypass. We don't do sleep. There are so many types of surgeries here.
Right.
In bypass, they eat decent.
Okay.
After 1.5 years, my patients eat 3 idlis at one go. What else you want?
Correct.
It's normally with 3 idlis. So what happens is, over a period of time, the stomach also stretches a little bit. They start eating good amount of food.
Good amount of food.
We have patients who are 6 years post-surgery, 7 years post-surgery. They're eating 4 idlis at one time. Like normally what we eat.
Right.
That's enough. Over a period of time, your quantity will increase.
But it's like in one lifetime, you can just have like one bariatric surgery, right? Isn't
Nothing like that. We can do n number of times.
Is that so?
Yes.
Would you like to elaborate on that, doctor?
So some patients, they do a basic procedure called sleeve. Some people, what happens, sleeve and all. In sleeve now, we reduce the size of the stomach. We don't do anything else.
Okay.
So what happens, this stomach will stretch over a period of time. The patients can't eat much. They can eat only 15 to 20%, but they start cheating on the soft calories. They drink beer.
Okay.
That is called soft calorie cheating. So like this, if they are not disciplined, they may gain little weight. So those patients, we convert this sleeve into bypass.
Okay.
That's the reason in Manipal Miller Road, we straightforward go for bypass. If I do a surgery, they should not come back again to us. That's what our aim is.
So it's like one time and they
time.
don't come
Most
back.
of the time. When they are in touch with us, they never gain weight.
Okay. Yeah, that's what it is. So, ಇವಾಗ ತುಂಬಾ ಕಡೆ ನಾವು ನೋಡ್ತೀವಿ ಇವಾಗ ನಾವು ಆನ್ಲೈನ್ ಶಾಪಿಂಗ್ ಮಾಡಬೇಕಾದ್ರೆ like whenever or any other shopping doctor I see that we have clothes up to L at the most XL, sometimes is double XL.
Correct.
There's never a 3XL or so, but nowadays people have started becoming more inclusive. But ನಾನೇನು ಕೇಳಿದ್ದೀನಿ ಅಂತಂದ್ರೆ in this center of excellence Millers Road ಅಲ್ಲಿ Dr. Moinoddin, you've done something very amazing, that is your doors are like inclusive, the chairs are inclusive. I was really very touched when I heard it because yes, only obese people know what's going through it, and it's so embarrassing when there's nothing that fits them.
Correct.
So I know that you are a surgeon and obviously you will think about it, but what is that point that actually made you feel that I should do this for the people?
See, madam, I was trained in Belgium, Taiwan, Korea, Bombay, Delhi. I was part of so many celebrity surgeries. Whatever in Bollywood, we have done so many.
Yeah, okay.
So, but the problem here is, what I feel is, if a person comes into our OPD, walks into our OPD, he shall never feel embraced where he should sit. He should not think twice where I should sit.
Yes.
Our OPD is, I will show later, our OPD is designed in that way. It's an obesity clinic. All our sofas are there. And no chair is like this normally.
Yeah, just the small one which only a kid can
No,
sit.
like that. Tummy should not hang out. Nothing like that.
Yes.
We have designed like that.
Right. What about the tablets, the medications? I'm a little interested to know because it can also leave a lot of residual feelings in people. So what about the medications, doctor?
No, actually, for example, if a person walks into an OPD, they always say, "Sir, surgery nahi, kuch aur bata dijiye." That's what they say.
But they're meeting a surgeon for that.
I know.
Yeah. Okay.
Because what happens, the lot of people who are surviving on weight loss,
Right.
starting from weight, Herbalife, this, medicines, tablets and all. People who try everything and they come back to us. The thing is, it will not work over a period of time. For example, you start on some tablets, some Herbalife, some keto diet, something. You may initially
It's not
lose that weight.
sustainable.
Initially, you may lose weight.
Correct.
You may lose that water weight and some amount
Right.
of fat weight. Over a period of, once you stop doing that, you are back again.
Right. Not sustainable. Yes.
And when you are back again, they are more than what you lost.
That's true.
So when they come to they have tried and exhausted with all this failed attempts. They come back to us. They say, "Doctor, I want to do a permanent solution. I want to fix it permanent in my life." That's how surgery works. If you are post-surgery, you are disciplined enough to walk half an hour or 1 hour per day, you will never gain back weight. If you are out of sweets and sugars and bakery items, post-surgery, you will not gain back weight.
Okay.
And if you are disciplined enough, you may not have loose skin.
Right.
So that's the reason post-surgery, it is like a permanent fixation of weight.
Okay. So I just wanted to know about the tablets, like, doctor. Is it too much that they need to consume and things like that? Like
Post-surgery you're talking
Yes.
about?
Yes.
Post-surgery, we don't give any weight loss medicines.
Right.
We give only multivitamins. Just what everyone has taken corona.
Correct.
Calcium, multivitamin,
Right.
neurobion and all
Yes.
these things. And along with it, protein powders.
Okay.
That's what we give.
So that's not like a tablet, not like the
it's
medical.
a supplementation.
Yeah.
It's a multivitamin supplementation with protein.
Right, right. So I want to ask something which is, I think is a very sensitive thing, which I feel is, when patients talk to you, do you fully know, are they fully ready when they come to you, doctor? Because many times they come to you out of shame. Sometimes they come to you out of pressure. Sometimes they just don't know what to do with their life. So a lot happens in the mind also.
Correct.
So before I get into more serious discussion, I want to know, do you kind of, like, when you look at the patients, do you feel they're fully ready for it? And if they are not, if they are still dilly-dallying, I know you assured them, but I'm just saying sometimes the patients come to you with half mindset.
Correct.
Does the surgery still work for them?
What happens is, madam, people who come with full mindset is, some of their brother would have done, some sister would have done,
so they have,
mother would have done. They know everything about it.
So then they are prepared.
They just come. Doctor, kab kar rahe ho surgery? When are you doing it? When is the date? That's one thing. The other kind of patients who come to us, they know only half of it. They would have known about YouTube, Google and all. They would have searched something. They would have heard good or sometimes bad. Those kind of patients are little in dilemma.
Correct.
So they come here. They
yes.
come to us and they say, Doctor, I'm really confused what to do. I have exhausted all the efforts, but I don't know what to do. I know this is the only way which is left for me, and it's a permanent way, but what to do? I'm a little confused. So those kind of patients, what we say is, we say that we are always there post-surgery for them to support.
Okay. Yeah, like you said.
That assurance.
Yes.
And one thing is, we invite them for our support group meetings, where we call post-surgery patients in one hall. Hundreds of patients come who have done surgery already.
Okay.
So those meetings they can attend and decide about the surgery when they are doubtful, and they can speak to our old patients.
Correct.
They can be in our groups.
Right.
And one more thing, what I feel is, we can't really convince anyone for a surgery.
Absolutely.
We can really not convince. We can put our point of view.
Correct.
We can solve their doubts.
But it's up to them totally.
Yeah, it's up to them.
So you will wait for them to, so that it comes from them.
I think if they are mentally prepared by themselves, the results are good.
So if I were to ask you about the mental health support that a patient who comes to you and gets the surgery done, what is the mental health and the emotional support that is available for the clients?
Yeah, I should not say this, but I think 80% of this world is depressed.
I agree.
One or other way.
Yes.
They may be depressed financially, psychologically, wife,
familial,
kids, responsibilities,
husbands,
thinking of future. And many of the things, 30% are overthinkers.
Yes.
If I do like this, they go somewhere else. So this is a problem.
You're right. Yes.
And especially this obese patient, they face social stigma. For the problem is, wherever the joke starts, it ends on obese person.
Absolutely.
One thing. Whatever, in India, what happens is, for example, in India, whoever is obese, they make fun of it.
Yes.
So in this way, what happens is, the patients are mentally depressed.
Right.
They will be on medication also, they'll be on therapy also who comes to us.
Yes.
They say more than the physical thing, mental thing is bothering them.
That's the thing, yes.
For those kind of patients, what we do is, we have psychologists who can guide them before the surgery.
So they're available here?
Yeah.
Okay.
We guide them before surgery and we mentally prepare them for the surgery. And post-surgery, we are always there. We always tell them, ping us anytime. You have a doubt at 6 o'clock, you ping us. We'll respond.
That is one thing I think which you have consistently told throughout the interview, that we are there for
them. We are always there.
Always there.
A person requires assurance.
Right.
Any person requires an assurance. I am there.
Right.
Then they'll sleep peacefully.
Yes, doctor. Actually,
understand, right?
Because if suddenly the doctor or somebody just becomes unreachable, then we are like, oh my God, who's there for me now?
They can catch us anytime here. So we're always there. Nothing to worry about it.
Right, doctor.
So the assurance, which is important.
Right.
And many of the times what happens is psychiatric patients, because of the medicine, they gain weight. They are schizophrenic or depressed. This medicines which you take for depression, psychiatric condition, this make them gain weight.
But is it okay to work on them also, doctor, if they are under medication for something?
I'll tell you one thing. When are you on medication, it is all about per kg body weight. If I am 60 kg, dolo 650 is the correct dose for me.
Right.
If I am 100 kg, 2 dolo 650 I require.
Oh,
correct,
okay.
right? Per kg body weight.
Okay.
Any tablet is like that only.
Okay.
So when they lose weight, the doses will come down.
Well, doctor, one more important question. That time you already said, when we were speaking, that people who do all kinds of diets and it's not sustainable, and so they become double the weight they were. So with bariatric, is there any such fear that it might be reversed again?
I think bariatric surgery is designed in that way to maintain the long-term weight loss. Many of the patients will have fear that if I do the surgery, this is a permanent. I can't eat again? No. If the patient gains, for example, after 8 months or 10 months, once they reach the target, we can always reverse them. We can reverse into normal stomach again.
Is that so?
Yeah, it's possible. That's a bypass we do. Bypass, we can reverse into normal stomach again.
So that will mean like double.
For example, a person is 100 kgs.
Okay.
He becomes 60. So 40 kgs they have lost. Now they say, no, I can maintain. Please reverse my stomach into normal stomach. I can do it. With the keyhole again. With the keyhole surgery.
The laparoscopic.
I can reverse it again.
Okay. So it is possible.
Yeah, reverse. That's the happiest moment for anyone. If I can reverse, that's very good.
Right, yes. How important is the support of the family?
What is happening is, family support is a key, but without family support also patient can manage. How exactly, I'll tell you.
Yeah.
So initially when you do the surgery, initially 15 days the patient will be on liquids. Clear soups, the juices, all this buttermilk and all this stuff. After 15 days they start eating semi-soft, puree diet.
Okay.
Oats, khichdi, upma, idli,
the
and all these things. Mashed things, soft things. After a month we can eat normal food.
Right.
That's what the protocol post-surgery. The help is required only the first 1 month to make the juices and all. If they're really, for example, if I'm working, if I underwent a surgery, first 15 days what I should do is 1 bottle I should make a juice, soup, buttermilk. Alternately sip. That's what I can manage at the office itself.
Correct.
After 15 days, idli and all.
So basically you're saying they can go to office also immediately. Okay.
Within a week.
Okay.
Within a week, I always suggest them, within a week you can be going to a normal work. Okay. That's how it is. There is no bed rest is required. That's what I say.
Right. No, but in what way can the family support them mentally? Now I understand with the provision of the food.
Correct.
But mentally, what is the encouragement and what is required basically from the family?
Any person who undergoes the surgery, they'll be thinking, I'm the only one who has done the surgery. I'm the alone person who has done the surgery. This is the feeling everyone will have.
So in a bad way you're saying?
No. For example, some person in a family undergoes, some ex-person in the family undergoes surgery. And the rest of the family members have not undergone surgery.
Right.
They'll be eating normally. So this person will feel, I'm the only person who has done the surgery.
Okay.
Understand, right? You will be eating less, right? So the other person will be eating normally.
Correct.
So they feel that I'm the only person who has done the surgery. So then, for that removal of this misconception, we have made a small patient support groups where you can be added in the group where there are a lot of people like that who underwent the surgery. So then you will feel that I'm not the only person. So many people are there who underwent the surgery.
But this is actually a real problem when everybody around you is eating normal food and you are feeling that way. So you should not feel that sinking feeling that
That is the thing, we have made a groups.
Okay.
Group is not just a group. Group is emotional, support, mentally, diet-wise, everything, the support happens with the group.
Right.
If you still feel, no, something has to be sorted, you can come to us.
Right.
We're always available for that.
Right. Okay.
And mental support from the family is very important, especially the spouse support.
Yes.
Spouse support is very important because the spouse should say, really, it's good what you have done.
Encouragement.
Because people should not regret post-surgery. That is very important. That's the reason people should be like, surrounding family should equally support them as a patient.
Correct.
Patient is, okay, I want to do this.
Right.
Okay, but along with it, the family support should say that you have done a good thing. You're looking good.
Right. That
Compared to last week, you're looking good.
Finally, it's just back to one important thing, doctor. So after a life-changing experience for people, how about resuming back to, like I know you said they can go back in 15 days and work, or they can go back in a week and they can work. But for them to feel normal, how much time might it take?
I think what I feel is more than normal, they should get adjusted with the diet. It takes around a month. Within a month, they know how much to eat, what not to eat. Okay, but we generally suggest them not to eat any sugary things and cola, Pepsi and all the stuff we have, bakery items. That's what we suggest them.
Right.
Remaining non-veg, whatever rasam, dal, everything they can eat in mild quantities.
Right. So basically, it's the food that is in the mind that is.
What is the advantage of post-surgery is your hunger comes down. which doesn't come down.
It's automatic. You don't even have to discipline yourself for it.
Automatically, you feel like you eat less. Your brain will say stop. You stop it.
Yeah. Okay. So I think ಬಹಳಷ್ಟು ಮುಕ್ತವಾಗಿ ಆ್ಯಕ್ಚುಲಿ ಡಾಕ್ಟರ್ ನಮ್ಮೆಲ್ಲ ಕ್ವಶನ್ಸ್ಗೂ ತುಂಬ ಪೇಷನ್ಸಿಂದ ಹೇಳಿದ್ರು. ಆ್ಯಂಡ್ ತುಂಬ ವಿಷಯಗಳು ನಮ್ಗೆ ಯಾರಿಗೂ ಗೊತ್ತೂ ಇರಲಿಲ್ಲ, ಬಿಕಾಸ್ ಇಟ್ಸ್ ಅ ಲಾಟ್ ಆಫ್ ಮೆಡಿಕಲ್ ಟರ್ಮ್ಸ್ ಫಾರ್ ಇಟ್. ಆ್ಯಂಡ್ ನಮ್ಮ ಮನಸ್ಸಲ್ಲಿರೋವಂಥ ಅವ್ರು ಹೇಳ್ದಂಗೆ ಓವರ್ ಥಿಂಕಿಂಗ್ ಮಾಡಿ ನಾವು ತುಂಬ ಯೋಚನೆ ಮಾಡಿರ್ತೀವಿ. Yes, so doctor, it was really nice that you took the time out to explain everything, because I think you spoke in the most easiest language. For the way you spoke also was very easy without using too many medical jargons, so everybody can understand what you've spoken. So I want to thank you for actually joining us today and telling us all these things, doctor.
So thank you, Neethu, for the interview, for the kind words and kind introduction, everything is explained in detail. But because you are in a glam field, you should tell them what exactly in this field, because there are a lot of misconceptions which are there.
Yes.
So it has to reach to wide public. And what I feel I always say one thing, and finally I conclude it. So life is like a journey. The lesser the luggage, the longer the journey. That's what I always feel.
That's absolutely
People should
true.
think about it, what I am saying,
yes.
and at least make small changes which can make them physically fit.
You're
Going for a walk, waking up early, and use, at least I feel a biggest gift a person can give for himself is a treadmill. Please, everyone buy a treadmill. Walk at least in a treadmill if you can't walk outside.
Right.
You don't have, because in the city space, you don't find much space to walk and all this stuff. Do treadmill at least 30 minutes per day.
Right.
25 minutes at least make your physical fitness allow. So what happens is that basal metabolic rate will be maintained.
Right.
So you don't gain much weight.
Yeah, and don't overthink also, like you said. No, but thank you so much, doctor, because really now, when I came here, I myself also had a lot of rebellious thoughts in mind, because it looks to me like, there's a lot of pressure and that's why we are pushed to do certain things. But actually you made it sound like there is a lot of support system. There's this pillows, you can always jump back and there are people to hold you. That is very assuring, doctor. So thank you so much, and it was a pleasure really interviewing you. It's a lot of knowledge. Thank you so much. So ಇಷ್ಟೊತ್ತು ಕೇಳಿದಿರಿ, ಐ ಆಮ್ ಶ್ಯೂರ್ ದ್ಯಾಟ್ ನಿಮ್ಗೆಲ್ರಿಗೂ ತುಂಬ ಇನ್ಫಾರ್ಮೇಷನ್ ಸಿಕ್ಕಿದೆ ಅಂತ, ಆ್ಯಂಡ್ ತುಂಬ ಈಸಿಯಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಜಾಯ್ನಿಂಗ್ ಅಸ್. ಬಾಯ್.